What if I told you that a program that provides healthcare for 1 in 5 people in the United States, which is nearly 80 million Americans, is facing deep cuts that would take healthcare away from millions? That's because right now, key leaders in Congress are actively considering proposals that would slash Medicaid coverage. And if Medicaid gets cut, the consequences will be devastating. Medicaid is this health insurance program for adults with low incomes, families, kids, pregnant people, seniors, people with disabilities. It was created in 1965 as this federal-state partnership, which means every state runs its own Medicaid program, but the federal government controls much of the funding and the national standards. Medicaid is how 40% of births in the United States are paid for. It covers 2 in 5 children and nearly 3 in 5 nursing home residents. For millions of working families, Medicaid means they can go to the doctor without worrying about going bankrupt. It means they don't have to choose between rent and healthcare. And if any of these proposed cuts go through, the hardest hit would be communities that already face systemic barriers. Low-income families, people of color, rural communities. Cutting Medicaid widens racial and economic health gaps at a time when we need to be closing them. It also isn't only those covered by Medicaid who would be affected. It's really all of us. Medicaid is the largest source of federal funding to states. That funding helps hospitals and clinics and community-based organizations remain financially stable. So while the specific proposals being considered by Congress vary, they would all reduce health funding and make health services less affordable, directly harming millions of Americans who benefit and really often survive due to these programs. Targeting Medicaid reinforces the ideas that some lives matter less, or that health is a privilege, ideas that Partners in Health has been fighting for decades. There is good news. You have power. Congress has tried to cut Medicaid before, and public pressure stopped them. Be that public pressure. Use your power to remind Congress that access to healthcare is a human right, not a privilege afforded to the wealthy. Contact your representatives. Tell them to protect Medicaid. There's a link in our bio or in our caption for a really easy tool to be able to do that. And share this video. The more people know, the harder it is for these cuts to happen.